بسم الله الرحمن الرحيم. Ventilator waveform analysis. Ventilator breath cycle and volume control ventilation, or the breath delivery by the ventilator during inspiration to the patient in volume control ventilation. And this can be analyzed by studying the pressure time curve and see the response of inspiratory and expiratory demand valve, which means when it opens and when it closes. This is the ventilator breath delivery pressure time curve in volume controlled ventilation. You start here. This is the triggering, and this is this peak inspiratory pressure. This is the inspiratory pause, which is set by the operator, and this gives you the plateau pressure, and here the beep. The demand valve will open here in response to the patient if it is assisted by the preset flow or pressure, or it opens by time according to the respiratory rate if it is controlled. By opening the demand valve, the flow will start. This flow is preset to go through the bronchial tree and then inflating the alveoli till it reaches the peak inspiratory pressure. This peak inspiratory pressure, when it reaches, this means that the demand valve will close, because at this point the preset tidal volume is delivered, and accordingly this pressure, this peak pressure, equals to pressure. This is the pressure resistance plus the pressure elastance. Pressure resistance equal inspiratory resistance multiplied by the inspiratory flow. When the flow is zero, this means that pressure resistance is zero, and we are left only with the pressure elastance, which is the plateau pressure, and this pressure elastance, which is the pressure in the alveoli, and this equals the tidal volume over the total compliance. By the end of this inspiratory pause, which is preset, and this inspiratory pause is part of the inspiratory time. By the end of it, the exhalation valve will open for the exhalation of the tidal volume. And when the pressure in the alveoli reaches the preset beep, the demand valve will close, exhalation valve will close. And so the demand valve, which is closed here, and the exhalation valve, which is closed here, remain closed till the second cycle. This is the inspiratory pause. In inspiratory pause, the demand valve is closed and the exhalation valve is closed. So no flow, and the tidal volume which is delivered is trapped to produce this pressure, which is the plateau pressure. That's why from this inspiratory pause we can measure the compliance of the lung, total compliance. This is important point, for this is the preset of inspiratory pause in volume controlled. Here, by the end of the inspiratory pause, the exhalation valve will open for the exhalation of the tidal volume. This is the inspiratory tidal volume, and this is the expiratory tidal volume. This means that the flow will come to zero, and the pressure will drop to the beep pressure. Thank you.